Thanks for joining us for the Portland Press Herald podcast. This time, Question 1. Proponents and opponents of Question 1, an act to legalize marijuana, face off before the Portland Press Herald editorial board, highlighting their points of disagreement on the upcoming referendum.
Maybe we should just go quickly around the room and introduce ourselves. I'm Greg Kesich. I'm the editorial page editor.
I'm Stephanie Anderson. I'm the Cumberland County District Attorney.
Scott Giner, campaign director for No on One and a certified prevention specialist.
Dean Perry, I'm a lieutenant with the Yarmouth Police Department.
Zachary Hayden, I'm legal director at the ACLU of Maine.
Mark Dion, state representative, Portland, Falmouth.
Alicia Melnick, political director for the Yes on One campaign to regulate and tax marijuana.
Ben Bragdon, I'm the editorial page editor at the Kennebec Journal and Morning Sentinel.
I'm Lisa DeSisto, I'm the publisher.
Sarah Collins, assistant editorial page editor of the Press Herald.
I'm Steve Greenlee, I'm the managing editor.
I'm John Zach, I'm the organizer with No on One.
And I'm Gillian Kramer, reporter, and I cover marijuana issues.
So, Alicia, we're going to ask you to start first. I think I know there's not a lot of shy people at the table, so I imagine people will pitch in. We'll kind of intervene if it looks like something's not being addressed or if it's one person is dominating. But encourage you as much to interact with each other and kind of identify for us where the differences are.
Sure.
So.
Whoops, I'm sorry.
Making sure mine's off too.
Yeah.
I apologize.
All right. Sounds like you guys got calls at the same time. What's going on?
Turning mine off right
Okay.
So, Alicia, what problem would this solve?
The Yes on One initiative would solve problems in a variety of ways. It would make Maine healthier, more prosperous, and safer for our communities. Right now, we all know that marijuana is here in Maine today. It was here in Maine 10 years ago, and it'll be here in Maine regardless of what happens on November 8th. What Question 1 would do would take a smarter, more realistic approach to marijuana use by adults. It would allow adults to be treated like adults instead of being caught up in the criminal justice system where they face sanctions that follow them for the rest of their lives in terms of creating barriers to housing, employment, and education. It would make Maine healthier by expanding access to many patients right now who don't have access to medical marijuana despite the best efforts of advocates. There are still only about a dozen conditions that are covered, and even those who have conditions, many of them can't get a recommendation because they can't afford one for the doctor who's willing to give them one, or their doctor is part of a health system or a hospital system that prohibits their doctors from providing recommendations. So even people like cancer patients who are clearly qualified are facing barriers to getting marijuana today. It would also make our communities safer by freeing up law enforcement who are now wasting their valuable time and about $9 million in resources annually going towards enforcing these marijuana laws could be freed up to address the sorts of issues that really threaten our communities. So things like domestic violence, the opioid crisis, and would allow for things like trainings of more drug recognition experts, as it happened in Colorado, where they've doubled their drug recognition experts to keep their communities safer. So we think this is, again, it's just a smarter, more realistic approach that recognizes that marijuana is in our communities today, it's on our streets today, and it will bring it behind the counter off the street corner so that the money, instead of going to drug dealers and then into an underground market, comes into our state through taxed, regulated businesses that ID their customers and follow the sorts of regulations that would be created by rule. So things like child-proof packaging, ban on marketing to youth, testing for safety and potency. So those are the sorts of things that we think would be a real improvement for the system we have right now, which has not been working, has done nothing to keep marijuana out of our communities or deliver safe marijuana to those who need it.
Do you have an estimate about how much money is spent that goes to drug dealers?
How much money is spent on the underground marijuana market in Maine today? I don't know the answer to that question. But I do know that the Tax Foundation estimates that we would gain around $15 million. I think it's a pretty conservative estimate annually in tax revenue alone. That's in addition to the money that would be tax money that would be collected by employment, by jobs that are created by this industry, and the savings that we would see in terms of law enforcement and court savings from not enforcing these marijuana laws.
Scott?
And I'm going to defer to my colleagues here for different aspects of this, the lieutenant, to talk more about the law enforcement piece of that, because I think he'll have some valuable perspective on that. But so my background is I've been working in the addiction field for over 10 years. As I mentioned, I'm a certified prevention specialist with a focus on preventing substance abuse amongst youth. And one of the things we know in prevention science is one of the huge influences on whether or not a young person uses are a variety of risk and protective factors. Some of those risk factors include the community norms that we set in our communities around drugs. We can set policies in place that are positive, that promote wellness and education and safety, or we can put forth policies that promote industry and making money off of drugs. That's what Question 1 does. Question 1 is all about installing basically Big Tobacco 2.0. It's about bringing to here an industry that is already starting to follow the Big Tobacco playbook in states like Colorado, with products that are clearly intended to appeal to young people, whether it's gummy bears, lollipops, sodas. So what we're asking Maynards to approve is something that will literally put gummy bears on Main Street. We're opening up, potentially hundreds of shops throughout the state that will be selling these products that are clearly appealing to young children. And these are potent products. This is not 60s and 70s Woodstock weed. This is the marijuana of today, which has drastically increased in potency. And frankly, the legal market has created sort of this almost a THC arms race to see who can come out with the strongest, biggest, best product. And so that's what we'd be inviting to Maine. So it's literally, profits off of addiction while we're in the middle of an addiction crisis. And it's just not a good idea for Maine. As has been reported in your papers, we don't have enough treatment resources right now to deal with the addiction that we have. So what we're asking Maynards to approve is an industry that would create more addiction, and then how do we deal with that? We don't have enough treatment resources as it is. And in my experience with the alcohol and tobacco industry is that they will fight you hard on anything that you're trying to put forth in terms of public health initiatives. So I think that's just the last thing we need here in Maine. And then, the message that sends to our young people, our young people pay attention to the decisions that we make as adults. Rightly or wrongly, when we passed medical marijuana, that did create some normalization amongst our youth. In 2009, we had 40% of young people who thought there were no risks from marijuana. Now it's 60%. That's risen 20% since we passed medical marijuana. Man, rightly or wrongly, it's an unintended consequence, but it's reality. When we as adults make these decisions and say marijuana is important, we need marijuana to make money, to fill budget holes. We need, that sends a very powerful, I think, destructive message to our kids that it's safe, that it's something we need to do. So I think as adults, we need to think long and hard about what are we inviting literally into our towns, into our neighborhoods, and what example are we setting for our kids. I don't know if you want to speak to the law enforcement piece.
Well, I came into this, I spent 2 years back in the late 80s, early 90s as working for the MDEA, which at that point was by. And I really went into it with an open mind. And I'm a product of the 70s, the 60s and 70s. So I really did go into it with an open mind. And it wasn't until recently that I started getting involved with the Rocky Mountain Haida people and taking a look at what it was, seeing it coming, seeing it on the horizon. I felt it was important, along with a couple other guys that are in a very similar position to mine, small departments, second in command, staffing, that sort of thing, to take a look at this from the outside and see how it worked out. So we started communicating very closely with the Rocky Mountain Haida and to take a look at what was going on out there, because in reading what's in place there and what's in place here, I think ours is even weaker than theirs out there. I know that the taxes are weaker, but when you start looking at the percentages of what you're looking at in increases, I've heard it said that marijuana use among the youth is flat. It's not in Colorado. It's up about 20%. And if anybody wants a copy of this, buckle up for the copier to explode. This is the recent one. I've got 3 of them. There are increases. You can go to analysis that don't include the states that have legalized, Oregon, Washington, and Colorado, where you can look specifically at something that is already acting along the lines of what we're looking at putting in place. And that's kind of where I'm going with it, because I want apples and apples, not necessarily, Iowa, which is, totally illegal. I want to look at a state that has taken this on. And when I look at it, I don't see a lot of positives. I really don't. When you talk about us using a lot of time from a law enforcement standpoint, that really is a specious argument. It really doesn't exist for us. We've had non-criminalized marijuana in the state for decades. We spend most of our time, I did a little number crunching out of what we're talking about, and I have 31 current summonses for marijuana this year. Only 2 of those issues are criminal in nature. They're both furnishing cases. And what that means is it's essentially it's a ticket. You have it in your possession. Most of them were derived from traffic stops where people were stopped for something else. Marijuana's in the car. Further investigation leads this, you wind up doing what you do, but it's a violation. It's not a crime. And they have been summoned for the same. The amount of time involved in that is minimal at best. It really is. It didn't take up a lot of time. And from what I could figure out of the 24,000 hours that we work in Yarmouth with a 13-man force, somewhere around between 38 and maybe 45 hours went towards that effort. From a percentage basis, it's minimal. It really is. It's very, very minimal. And I think that that's important to look at right up front. What I'm looking at when you make the changes that you're looking at, is availability as it is in Colorado right now. It's kind of gone off the charts, and I don't think it's really a straight face test. When you look at somebody and say, we're going to make this available to the public without a lot of construct to control it, and there really isn't. This comes under the Department of Agriculture. This doesn't come under the state. There's no Bureau of marijuana licensing. It comes under the Agricultural Bureau. And I've been dealing with the medical marijuana, which, by the way, I can say right here, I'm a big fan of cannabidiols. I really am. I think there's some worthwhile stuff there that you can do a lot of things with. It's one of those products that if you get it to the point where you can dosage it and make it work, it's a very positive product. What we don't have is that in place. What you're doing essentially is giving somebody something and saying, take this until you feel better. From a dosage standpoint, you don't see a lot of stuff out there that's like that. You really don't. So that's something that concerns me a little bit. The percentages, again, as Scott said, have kind of gone off the charts. The ability to create edibles with unknown quantities in them, upwards of 80% if you're doing it right. There's an element of risk there, certainly. But when I look at what's happening to the black market, which has flourished, 3 states were suing Colorado federally based on the interdiction that they were having coming out of Colorado. They were having to deal with the stuff that was coming out of Colorado, storing it, prosecuting it. So they wound up suing Colorado. I don't want to become the Northeast Colorado in that respect. I really don't. I don't want to be ground zero for a black market. It flourishes because of the lack of controls. What we don't have in place to manage this. There's really not a lot out there, and I'm speaking specifically of the medical marijuana program. Anecdotally, I had at least 2 situations where caregivers were violating the law blatantly, including federal law, shipping marijuana out of the state to people, and I couldn't get the state involved. I couldn't get them even remotely interested. And I knew Marietta personally because when this whole thing started, I invited her to come down and give us a perspective. I asked, can you come down and give my troops an idea of how we're going to deal with this? Because they want to know, and I want to know. And the training consisted of her essentially standing there and saying, I have no idea. And I got a lot of feedback from the guys that were very interested in making that work, because there was no feedback at all. There was nothing that we got from the state that allowed us to deal with this sort of thing. It was very open as to how can we give back marijuana if it's a violation of federal law. We need to get attorneys involved. We need to get people that were part of the process online, and we still don't have that in place. That's still not working. Marietta has since left the position, and I don't even know who to contact at this point. I haven't been brought up to speed on that. So I'm looking at that situation. I'm looking at increasing the amounts, the potency, and making it legal. And like I said, from a straight face test, if you say this is going to become legal and you don't think the kids are going to get involved with this more, I just don't think there's any way to do that. I don't think you can look at yourself in the mirror and say, everybody's going to use this that's responsible and capable, and they're going to stay away from the kids, because that's never been the case with alcohol. And once you start talking about alcohol, regulating it like alcohol, it's not going to be regulated like alcohol. It's going to be, like I said, regulated by a different agency. There's no MOUs in place for us to deal with this stuff. Right now with alcohol, there are. We can step into an organization or a bar. We can work instead of the state, or at the behest of the state. We can go in and tell them that they're doing something wrong. We can shut them down. We can summons them. We can't do that here. There's nothing in place for that here. It's pretty much an administrative function. And that concerns me. It really does. Because I'm not really sure how to deal with that. And when you look at what's happened in Colorado with 400, pot shops and only 322 Starbucks, I'm used to walking out of a Starbucks and looking at a Starbucks and going, hey, there's a Starbucks. I just think from a percentage standpoint, it's definitively a revenue stream. I'm not sure you're going to get people to give $1.3 million for advertising that don't have some sort of vested interest in getting something back out of that. Always suspicious of people who are looking to make money off of something that is untried and possibly untested. But those are my major concerns right there, is just getting into the hands of people that shouldn't have it, and that includes the black market. Again, I would ask anybody who's interested in how this has worked out in Colorado to read this. And this is vetted stuff. It's not stuff, there's some good, there's some bad, but it's mostly bad. And until that's taken care of, and when you talk about DREs, they've doubled their DREs because they had to.
Do you know what DREs are?
No.
I'm sorry, drug recognition experts.
Oh, okay.
Right
They
now,
don't know what HIDA is either.
Oh, HIDA, I'm sorry. High Intensity
figured it
Drug
out.
Trafficking
Okay.
Task Force. Rocky Mountain, New England, they're set up around the country. My apologies for that.
I want to make a couple of points if I may.
If we could
we just have a
respond,
chance
I mean,
on this side of the
we
table?
can go
Absolutely.
forward.
Go ahead.
Could I just take one issue with there's a lot you said there. I just
Yes,
want to go
there
back to
was.
one point you said at the beginning. Lieutenant Perry talked about how minimal this was in terms of staff time. And I don't doubt that that's true in terms of the Yarmouth police, how much time they're spending on citations. But it is definitely not the case that this is minimal for the people who receive those citations. This puts a serious crimp in somebody's life if they're caught possessing marijuana under
How
current
does it
law.
do that?
It could prevent them from getting student loans. It could make it harder for them to get a job. It could make it harder for them
It's
to get
a
a housing.
traffic ticket.
These are all things that they would have to disclose. That's not how a lot of employers and a lot of places look at it. That these are things that people are asked on applications, and
I've
it
never
could.
seen an application that had that question, Zach.
We'll send you a copy.
I'd love
They
to
say
see
other
it.
than a traffic violation, write down any conviction for any other violation of law. That's what the applications say.
And I think what part of the support that we've seen for the yes on one side is people recognizing that doesn't serve any benefit. It doesn't serve any social benefit to have that crimp in somebody's life because they decided that they wanted to use marijuana.
Yeah, but you can solve that through a policy reform. You don't have to create a commercial industry to solve that. And I would be happy to sit down at the table with the ACLU and with folks to craft those policies. You don't need to create Big Tobacco 2.0 to solve that problem.
Well, what happens is you sort of end up with these two different positions. Either you're saying that it's incredibly dangerous, or you're saying that law enforcement isn't spending that much time on it. Both of those things can't be true. I think what people are recognizing, why there's been
they
so
can be
much,
true. Absolutely true.
why people I think
I
are
disagree.
supporting yes on one is they're recognizing that the policies we've had for the past have failed. And that's true of people in Maine, it's true of people across the country. And they're recognizing that it's time to try something different. With regard to law enforcement resources, prosecutor resources, for too long we've asked the police and prosecutors to be responsible for solving all of society's problems. And they can't do that. You can't do that with any of the resources you're given. You certainly can't do it when resources are limited. And people are recognizing that they want to have resources allocated, law enforcement resources, prosecutor resources, jail and prison resources allocated in a smarter way. That means saying, there are things people are going to do with their own lives. We have ways of regulating it. We have ways of approaching it using education, using the tax system, that are going to be smarter than asking the criminal justice system to solve these issues.
The criminal justice system isn't involved in possession of marijuana. I mean, you can have 150 joints before it's a crime.
So when you go to court and a police officer is testifying against somebody, what is that? Is that not the criminal justice system? That certainly feels that's certainly how it feels to the person that's caught up in that system, that's forced to pay a fine or face jail time, that's forced to write this down on applications that impede their ability to get housing, employment, and education. It's true. People have to go. People have to go to court. People have to pay fines.
It's a traffic ticket. It's a 200.
It is not a traffic ticket.
300.
It is a citation for a drug violation.
Oh, it went up.
And in terms of youth use,
don't they have to get it from somebody? I mean, somewhere if
they get a ticket. I don't discount what the district attorney is saying. It's handled at the lowest possible level of the system as a civil infraction, and that's a comfortable concept for practitioners. Right? To us, it's like a low-grade inoculation. You were bad, here's a ticket, and I'll give credit to the district attorney's office. They even provide an opportunity to do 30 or 40 hours of community service if you don't want to pay the fine.
And you don't get the, yeah.
Yeah, so I'm going to put that on the table. That's real, that's realistic. But then when I step back and talk with real people about how they experience it, they've been in the courthouse, they've had negative contact with the police in their mind, setting aside there's some culpability because they had the contraband with them. I see that, but for them, it's a more significant experience than we give credit for. I mean, I'm involved in this campaign for a couple of reasons. One, I know Dean's smiling because one of the cases he referred to, I represented the woman in question, by the way. She pled guilty. She was in violation of the law in her conduct. So I'm not dismissing those realities. But when I look at the bigger picture, we have been trying to manage marijuana for over 40 years using the model that they're proposing. What we did last week, we intend to do next week. And to some minds, it's a successful way of doing it. And if we look at the data from the Uniform Crime Reports for Maine, half of what we do when we talk about drug enforcement is generated by marijuana. Half of what we do. And I, for one, as a former police executive...
Can you explain that? Because it sounds like at odds with Dean saying that there's only 30 out of...
Well, I think with
if you're talking about a percentage, he's right. I mean, over half of those were violations.
Half of the work product...
But from an hourly standpoint, it's very minimal. Okay. That's what I'm saying.
Well, it's minimal by you, but then it goes to a clerk, then it goes to a DA.
How many of those are 2.5 ounces or less? Because above 2.5 ounces doesn't change.
Scott, I appreciate it. Can I just finish my thought? Because if I lose it at my age, I won't get it back. Okay. Half of the work product generated by police officers in Maine is focused on marijuana. I, for one, would rather see it focused on opiates. That's a real crisis. That's a real threat to the public safety. Wait.
What is work product, Mark? I'm not...
Well,
What do you mean by work product?
In terms of looking at the UCR data, what's reported as cases or arrests, I don't like to use that word. The FBI uses that word. But if we just look at the raw numbers, half of what Maine police officers do when they say we do drug enforcement, whether it's handled minimal or not, it's still counted.
It's handled minimal.
Half of that, and I think Dean's agreeing with that, has to do with marijuana.
But how does this change that? I mean, if somebody has if somebody has 3 ounces, you've got to determine whether they had more than 2.5. You're still going to have to say, figure out whether or not they're 21. You're going to have to figure out. There's probably some other issues in terms of enforcing this law. What makes the police work go away?
Well, I think what makes
it doesn't
go away.
It gets
still stops.
It gets absolutely huge.
I don't think that's true.
Wait. What I wanted to say is we look at it historically. Our efforts at managing marijuana in the communities has been pretty consistent. It's been status quo. We haven't gone up, we haven't gone down. We just crank it out year after year. So if our goal is to deal with this, criminal justice has met its top performance. They've shown us by their data this is the best we can do. I know this might be heretical to some at this table, but I think it is time to look at it like alcohol or tobacco, because at least no matter what challenges we face, we begin with the assumption that it's a regulated industry and we will handle it through civil enforcement and we'll handle it through administrative regulations and we'll take the money out from the back room. You asked Alicia how much money is involved. We frankly don't know. It's all speculation. at least we'd have an idea of what the money is involved and what we can do there. And the other part that I just want to address, we're having this conversation like we're going to get hit with a tsunami of cannabis the day after the election. I think what's there is there. It'll just come out into the surface so we can actually start to manage and regulate it outside of criminal justice. I think that's an important thing. And the last point that I want to make at this moment is passage of this question doesn't mean the very next day everything is honky-dory, that we've addressed every issue, and there's some legitimate issues from the other side of the table that need to be addressed. I'm kind of surprised you didn't bring up driving while impaired.
That's coming.
They shut
That's
me
coming
down.
later? Okay.
That was going there.
And I think if we look at the medical marijuana statute, I was there in '99. I supported it then, so this is not a new position for me. We've been at it for what? Over a decade, making the rules. And I think we have a system in place that makes sense. It could make better sense. And I think that's a model that we will use in this process. And if we do pass one, the critics become collaborators because I think they have questions that need to be resolved in how we build that system. I'm simply saying the current criminal justice management model guarantees the status quo. If that's the case, we can all leave, find ourselves a dealer, shake hands and say, look, it's all going to be the same tomorrow. Good luck.
Well, so
Wait a minute. So I would like us to consider the possibility that we can adopt a new model. I mean, it's a bit hypocritical to say we know that alcohol and tobacco have negatives and we struggle with those negatives, but we also know they have positives. They do add to the economy of our state. And we do treat adults like adults, and the vast majority of adults make reasonable decisions around the uses of those substances, and we're simply saying they should be allowed to do so in this context as well.
Well, so just an interesting measure around the success of alcohol versus marijuana. You say, we're failing with marijuana and we're succeeding with alcohol regulation. If we look at the main integrated youth health survey, that data would question that. Regulated alcohol, we have higher underage drinking rates in this state than we do youth marijuana rates. With alcohol, it's 1 in 5. It's 1 in 4. With marijuana, it's 1 in 5. So we have
Would
more.
you suggest making alcohol illegal for adults?
No,
to address
absolutely
that
not.
issue?
I would suggest not adopting.
I could do that. No.
I mean,
I would
honestly, what's the solution to that problem?
I mean,
Well,
that's not an unreasonable position. There are people who think that there should be no intoxicants available for anyone. That should be the goal of society, to get to a place where nobody uses alcohol, nobody smokes cigarettes, nobody uses marijuana or anything. It's
But
not.
that's not my point. The point I'm making is, so what is driving that? It's the industry. It's the alcohol industry, the having an industry that markets products that are attractive to children, which they are still doing. Bubblegum flavored vodka. The tobacco industry is still doing it. This is what we're talking about. I mean, what you're talking about is great, but the price tag is an industry, and it's a profit motive industry. They're going to want to make money. They're not going to want to decrease their customer base. They're going to increase their customer base.
What part is great? I'm curious.
What part is great?
What I said was great.
The idea that
The theory.
the theory, but the reality is much different, because you're not talking about the industry. The industry is what is driving a lot of the harms with alcohol. It is what is driving the harms with marijuana in Colorado.
There's already a marijuana industry in Maine. It's a booming marijuana industry that's been around for decades. It's going to be around regardless of whether this passes
It doesn't have
or not.
storefronts with gummy bears in the window.
The storefronts would allow for people to get marijuana they know has been tested for safety, that they know how strong it is. It's going to be able to be sold in child-proof packaging with restrictions on marketing. They've looked in other states. We have the ability to ban shapes that are cartoon characters, that are animals, that are brightly colored. We have the ability to do many of those things that we know will restrict appeal to youth. And we also know what works in terms of keeping kids from engaging in risk-taking behaviors. And it's not prohibiting marijuana use by adults. If you look at the federal Substance Abuse and Mental Health Services Administration report, they show that even in places where they've seen a significant decrease in perception of risk by youth, they've seen no increase increased youth use. And in states that have legalized, there's no increased youth access. And that's from the Colorado Department of Public Health and the federal government. What we know works in terms of keeping kids safe and keeping kids healthy. And I absolutely share the concerns of everybody around this table for making sure that the youth in our state, the adolescents in our state, make smart decisions that keep them healthy and give them bright futures. I'm a mom myself, and I want to make sure that, right now kids, about 80% of teenagers say it's easy to get marijuana. We have the ability to do something better and to put money towards treatment and prevention programs that work, education programs that work, addressing child poverty and child hunger, a lot of the things that actually make kids more likely to engage in risk-taking behaviors. We have the ability to take some of these resources to stop being distracted by adult use, which is not enforcing stronger adult use laws does not result in less teenagers using marijuana. What works for kids not using marijuana or other substances are a lot of the evidence-based prevention and treatment programs, mental health counseling, supportive adults and peers, many of the things that we could actually provide more resources on and focus on instead of being distracted by a system that has not worked for decades.
Again, I'm a certified prevention specialist. The prevention science says one of the evidence-based practices is positive community norms.
That's one. It's not the only one.
It's not the only one, but it's a huge one. And the norms set forth by adults, the policies you have in place.
But do you need it to be illegal to set community norms? Aren't there other community norms that are set culturally?
Those are a fact, but the rules and the policies we put in place are also huge issues as well. Same with alcohol. If we have loose alcohol policies, that influences higher underage drinking rates, which we have in Maine. Again, we have more underage drinking in Maine than we do have youth marijuana use.
Yeah, and I want to I just want to jump in here if I may. Your first question was, what problem does this address? And you never got an answer to that question. The answer you got was, this is going to make Maine healthier, safer, and more prosperous. And I think that's a statement that cannot be backed up in fact or theory. When you're talking about healthier, putting aside the issue of increased use by children, which everyone at this table disagrees would be a bad thing, so I'm not even going to address that. But let's just talk about marijuana use to begin with. Number one, and there's a lot of science out there now, 4 joints a week is as dangerous, poses as many health hazards as a pack of cigarettes a day. Now, there's been mention that, look at what alcohol and tobacco has done for us. I think alcohol and tobacco have done really devastating things for us. And the revenue that's talked about on the other side, number one, is not, I think it's going to be minimal. But no matter what it is, it's really an undisputable fact that the amount of money you spend to combat the ill effects of these things, like tobacco and alcohol, is 10 to 1. So for every dollar of tax revenue that gets generated by these schemes, you're spending $10 to deal with addiction and enforcement and, dealing with the fact that this substance is legal. The number one, in 2010, the number one reason, there were 132,000 kids, 12 to 17, admitted to publicly funded treatment centers. Of that, the vast majority, 283 per day on average, were there for marijuana addiction. Now, in 2014, that number changed a little bit, but the number of youth admitted to state-paid-for substance abuse treatment centers had tripled in those 4 years. The number one reason was heroin, but the number two reason was marijuana, and it went from 283 kids per day to over 300 kids per day. So it's a serious problem. This is the reason why the groups opposed to this legislation include the Maine Chiefs of Police, the National Alliance on Mental Illness, the Maine Public Health Association, the Maine Hospital Association, the Maine Association of School Nurses, the Alliance for Addiction and Mental Health Services, and Day One. All these groups are opposed to this legislation.
Do you think there's any low-risk use by adults?
Can I?
Yeah, I think there can be low-risk use by adults. But let me just say this. 1 out of 9 adults who use marijuana will become addicted. 1 out of 9. And it's 1 out of 6 if you start using as a kid. So, yeah, 8 out of 9, I guess, won't become addicted.
And those are studies using old studies using weaker THC marijuana, should be knowing that. Those studies haven't been replicated with the stronger
What's marijuana
marijuana.
addiction look like? Because I know what heroin addiction looks like. That's a problem. I'm not sure that...
Well, marijuana addiction looks like this. There's a thing called amotivational syndrome. Have you ever heard of that?
Yeah, I think I know a number of people that have it.
Well,
maybe not clinically.
It causes that. Recent studies show that it actually decreases IQ.
There's lots of conflicting studies. There's lots of studies now that are twin studies, for example, that debunk a lot of the research that she's citing. I'm happy to give you a lot of that research. And many of the youth that are directed into these sorts of programs are done so that they can comply with requirements by courts, not because they or their families or any kind of treatment provider have diagnosed them with any sort of addiction problem.
Well, you can't access state-funded treatment without a science-based assessment.
So, and I would also just say, in terms of being healthier, marijuana is a known natural alternative to prescription painkillers. We know that in the state of Maine, the vast majority of people that are dying from opioid overdose got their start with legal prescription medications, and that for many, many Mainers, including veterans and other patients, even though it's not a qualifying condition, they're able to reduce their use of opioids, get off of opioids, treat their addiction through marijuana.
That's
Many people are able to use their to address their chronic pain through use of opioids. A recent study in the Journal of Pain, for patients suffering from chronic pain, marijuana use was associated with a 64% lower opioid use, better quality of life, fewer medication side effects, and fewer medication used. In states that have medical marijuana where people can access it for opioid use, they see a significant reduction in opioid overdose deaths. This is a true reality, and it makes more sense for a state where people are dying regularly from opioids.
And we have medical marijuana.
No, I'm not gonna.
We have medical
opioid
marijuana.
addiction,
You're saying
not
what
for
your
opioid
your
addiction.
argument is
Then change where you're focusing
your
on medical
argument is that
marijuana.
we want people.
We've been trying to do
use
that in the
We want
legislature
people
for
to
years.
use recreational marijuana to treat their real or imagined medical problems. You can get medical marijuana for headaches, for PTSD. You can get it for basically anything.
Many doctors are
40,000
not able or
people in the
willing
state
to
of
give
Maine are using
recommendations.
medical marijuana.
Number one, PTSD isn't just anything. That's a serious affliction.
Well-
And number two, there are a lot of reasons why people aren't able to access the medical marijuana system.
Well,
They may not want to be
if I
officially
may,
registered. Let me just finish this thought. They may not want to be officially
Registration
registered
is
because of
voluntary.
their job.
Registration is
They may not
voluntary.
have a doctor who's willing to provide them with a recommendation, or they may not have the money to afford the registration.
Just as a
There's
practical.
Hang on
hundreds
just
of
a second.
doctors who will be, there's an ad
There are
in
not
the
hundreds
Portland
of
Press
doctors.
Herald or the Falmouth Forecaster that says free medical marijuana evaluations for college students.
We don't
by
read
a
the
doctor
forecaster.
in
We
Falmouth.
only read the Portland Press Herald, the
Okay, I think this
Kennebec
is
Journal.
All right. This is
Let's
done.
put some money in the
Morning
door.
Sun,
There you go.
If I may, I don't want to jump into an argument, and I don't want to create one. But like I
Good,
said,
because
I'm
you're
a big fan of cannabidiols. It's the useful stuff in marijuana. There are 200 people working for the FDA right now. Britain's doing some amazing things with those. They're trying to get that to the point where you can actually dosage it and make this something that you can get to people that I think is going to be very, very worthwhile. I really do. I don't think that that's even a question. And in that respect, I understand exactly what you're saying. If you want to work on the medicinal marijuana aspect, I support that 100%. I really do. If you can find a way to make that workable and to get that opened up, and you want to do any kind of legislation that helps with that, again, I don't have an issue with that. I'm a veteran. I never served in combat, but I've been doing this for 31 years, and I can't say as I don't have some flashbacks occasionally. I understand where people are when they want that, and I feel for them, and I deal with them in the field constantly. I really do. This is nothing that's new to me, and that's why I've maintained this position of trying to be in the middle as much as I can. I support that. That being said, this is not the way to do it. This is not the way to do it, and this is what you're looking at. Actually, on a weaker basis, I would recommend that anybody who's even thinking about this, read this. It's a pain, but it's got everything that you need in there to make up your mind about this. This is not the way to solve this issue. It needs to be dosaged. It needs to be regulated. You need to get it to the people that need it. You're right. There are people that can't access this stuff. You need to get it to them. You need to bring doctors up to speed on this stuff. You need to take the same doctors that were giving away opiates like candy for a long time. You need to bring them into the fold. I spent 4 days down in Atlanta at the opiate conference this year. An eye-opening thing, if there ever was one, as to how this is all connected. And this is all connected. There's no such thing as just marijuana or just opioids or just alcohol. This is a connected syndrome here. This is stuff that's all tied in together. Opening this up to, I think I'm just going to use this stuff. What's that?
It's here.
Let's assume it is open already, right? There are kids in Yarmouth, they're blown a bone right now, okay? Whether you like it or not.
But that doesn't make it okay.
Wait a minute. It doesn't make it okay. I don't think it should be okay. That's the whole premise. My kids went to Deering High School. Thank God, despite my efforts, they turned out to be reasonably intelligent women, okay? And they're successful. And they were confronted with marijuana in school. And I don't know how many times they came home and we'd have a conversation. They said, Dad, getting weed is not a problem. Getting a six-pack, that's a challenge. All right? For them, it was. Maybe they were running in the wrong circles. But for them, it seemed easier to get access to weed. Now, they experimented like a lot of teenagers do, and thank God for the people in their lives. They moved on, and they became mature, responsible adults. Okay? But when I look back, we had a much better handle on alcohol enforcement than we do on marijuana. Remember, we know who the retailers are, or should be. I didn't run into a lot of bootleggers. All right? Maybe they're out there. I wasn't smart enough to find them. But when we talk about what's going on in marijuana, it's a big bag that we reach in, and we kind of hope we have data. Like, I'm concerned about what Stephanie talked about, the addiction rate, but as compared to what? It's an unknown population.
It's not totally unknown. Wait a minute. It's not totally unknown. Well, you jumped in on mine.
I did?
Yeah, you did.
I thought I
wasn't even close to finish there.
I thought I complimented.
I haven't even addressed the 82 DREs that we have that we'll need to triple or quadruple. There's a lot that's going on here. This is not the way to implement it. It really isn't. It's fast. It's flexible.
It's not fast.
It is.
It's not fast.
It is.
Well, can I jump in on?
Mark, are you finished?
Well, I've been sufficiently restrained.
Can I jump in on two? There's 2 points. I wanted on the last one. The data that we have in Maine shows the inverse of what you just said. The Maine Integrated Youth Health Survey shows that kids feel they have more access to alcohol than they do marijuana. You look at the 2015 numbers, more kids say they have easy access to alcohol than they do marijuana. Now, I will not dispute that they have easy access. The numbers for marijuana are too high. They're higher than they should be, but they're lower than the rates these for the numbers for alcohol. And again, as I said, we have higher underage drinking rates than we have youth marijuana rates. The second point I want to get to is this idea around passing this to expand medical marijuana, and frankly, I think that's just a naked political ploy. It's to conflate medical marijuana, which is, it is a popular program. I'm not going to dispute that. But this is a political play to gain votes.
In what way is it a political
Can
ploy?
I finish, please?
It's a revenue stream.
The idea that we are going to tell people we need to legalize a recreational drug for you to access medicine. We don't send people to the bar to treat their depression. We don't tell people to go use recreation. We usually make that
decision by ourselves.
Are you a doctor?
No,
I mean, our medicine. We have regulations around medicine. This needs medical oversight. It needs scientific backing. Right now, the medical marijuana program has no scientific backing. It's a political process. It's not a scientific process. And so now we're going to make that worse. We're going to say, you have whatever you have. Go to WebMD, diagnose with what you want, and then go to your dispensary to get the marijuana. There's nothing in the bill that says you have to consult a physician. There's nothing in the bill that says anything about this. This is a political play. This is to get the sympathy of people around medical marijuana to vote for this when it's not even in the bill. And just the idea that we're putting forth to self-medicate, to self-diagnose, and self-medicate with a recreational drug, that is a dangerous, and I'm going to say irresponsible message that we're sending to our kids. That is like the worst message your
Do you
campaign
think they
has
can
put
sort
out.
that out from all the commercials they see every night on TV?
Yes, they can.
I wish I could have the diseases they have because they look pretty good. But they're told this pill, this consequence, everything's happy. They get a lot of mixed messages. It's not about substances. It's about whether our children have been given skill sets so they can make informed decisions.
It is about substances. It's about making money.
But where's the doctor that makes that informed decision?
Well, this is now this is going to give people an opportunity to talk to their doctor about it. The person they're not going to have to talk to is the police officer. The person they're never going to have to talk to about it is the district attorney.
Fix the medical aspect of it then. Take care of that and work on that, but don't bring it in wholesale.
Because I think we're talking a lot about the medical aspect, but really this is about recreational use.
It's about adult use.
Adult use for
any kind of reason.
And when you kind of would like you to address why do we need a law to prevent adults from responsibly using the substance that most people who use it use responsibly and
Well, I wish it were that simple, but it's not that simple because it's the industry that's going to come along with this. It's not just as simple as adult use because what adults do impacts. This is not an individual thing. This is an environmental thing. Mm-hmm. Just as the tobacco industry and the alcohol industries have created tremendous damage to our communities and to our young people. You can't just compartmentalize it like that because it's not that simple. We're talking about a sea change. We're talking about something that's going to fundamentally change our communities. I mean, we can say what we want about the black market. I am no fan of the black market. First of all, it's not going to go away. It's alive and well in Colorado. In fact, the Denver police need more resources to store the marijuana, the illegal marijuana that's growing in their state. They need more resources. But the black market doesn't have storefronts selling gummy bears. They're not advertising in newspapers. They don't have a cannabis sectional like they have in the Denver Post. That's not going to go away. And there are young people who have absolutely no access. My daughter is in middle school. She's 12-years-old. She doesn't know anything about marijuana. She doesn't know anybody who has marijuana.
It's time for you to talk to her about it.
Well, I talked to her about it. She has no access, but there's empty storefronts in Gray right now where I live, where people are already coming to the town of Gray and saying, when this passes, it's not going to pass, but if it passes, we want to set up shop here. There's people, they already want to.
And your
my daughter
community
will have
of
to walk
Gray
in
will
front
be
of
able
those.
to make that decision about whether, as a community, you want to have those shops in your community. And we, as a state, will be able to prohibit things like marijuana in the shapes of gummy bears. So this specter that there's going to be this giant gummy bear in a storefront is not reality. Again, we know how to prevent marketing towards children to create those sort of restrictions. It allows the Department of Agriculture, which is the state, by the way, to create those rules.
None of that's in there.
And that's the type of things that we'll allow to have.
This is like tacit.
I want to ask a more fundamental question. So if I'm an adult over the age of 21 and I'm walking down the street with 2 ounces of reefer in my pocket, and the odds of me getting arrested for that are
they're nil because it's not a crime.
Almost uncountable. Or to
you
have
can't get arrested for that
unless there's something else going on, and if the same adult is using marijuana in their house, the chances of them coming into contact with law enforcement are virtually nothing, and that's really what I think this law would make officially legal. Mm-hmm. This sort of activity that's already going on that rarely results in bad. And I guess my question is in light of what you're hearing about sort of the ancillary effects, the unintended consequences, isn't it kind of selfish for people who are already, if they're responsibly doing this substance, are not exposing themselves to much harm, creating an opportunity for all this associated crimes?
But here's the problem, Greg.
But I'm asking them.
Here's the problem.
Okay.
Your storyboard ignores the original sin. As a matter of fact, none of us talk about the original sin.
What's the original sin?
The original sin is the actual transaction that got that reasonable adult access to the product to begin with. That's not necessarily subject to civil enforcement. I mean, somebody had to furnish or traffic in order for that to occur. Mm-hmm. Right? I mean, I don't think there's any dispute about that. That's the point where a reasonable all but for law-abiding individual finds themselves in a context that they could be defined as a criminal at that juncture, purchases something that we then are not quite sure how serious it is from a criminal law point of view, and that has to be resolved. We never talk about the original sin. Where did this come from? Where did this legitimate or quasi-gray market contraband come from? It comes from a sale somewhere. And that gets back to the market. Well,
and in terms of the person that's getting it, this would give them much more information, because they would be able to know about that it's safe, that it's been tested for potential for any adulterants, and how strong it is. Again, this talk about this is not your grandparents' marijuana. There's also incredible progress in terms of developing strains and products that have no intoxicating effect whatsoever. And I know people personally who are professors at local schools, for example, who had to buy a lotion on the black market to treat their knee replacement surgery because they didn't want to have the fact that they are using medical marijuana on a medical record, because they were afraid it was going to have ramifications on their employment. Now, people over there might say that's ridiculous, but this is the experience and the perception of people that are out there trying to use these products. So instead, he's getting it on the black market, and from a person who they don't really know what's in it necessarily. Again, this would create a situation where, and I know people too who use a little bit of marijuana, who have really tough physical jobs, and it helps them relax and sleep at night. I know, again, there'd be serious objection on the other side of this table that someone is choosing to self-medicate, but for them, it is not creating. They are hardworking, good parents, tax-paying members of our community. I don't think those people should be subject to criminal penalties, particularly, or civil penalties that could follow them forever, particularly when it does not do anything to reduce the exposure, the availability, or the use of marijuana in our state by youth or adults. Again, it's here today. And again, you keep talking. Would you make alcohol and tobacco illegal for adults?
No, but right now we have policies that are decreasing.
Why is that the example? Why wouldn't you make tobacco illegal for adults?
So you would make it tobacco today illegal and alcohol illegal for adults. And what about prescription medications that kill people, or Tide Pods that kill people, or cell phones that distract people while they're driving? These are all things that we balance
discounting addiction and impacts on our youth.
I don't know what a Tide Pod is.
A Tide Pod is the detergent that there's now lots of public education radio ads that I've been hearing.
Not quite enough.
Apparently youth are ingesting them. So there are risks that we face in our society. We face a level of personal responsibility as adults in our community for making smart, responsible decisions for ourselves, and for making, helping provide our children with the tools and the resources to make smart, responsible decisions for themselves.
Well, we say the same thing about guns and all kinds of things. We make regulations to control things because adults don't always make good decisions.
That's why we regulate them.
Sometimes adults make bad decisions.
I have a job because people don't do things responsibly. I'm kind of happy to have it, but at the same time, there are reasons that I'm in place here, and that's changed over the years, and it will change again. But the reality is, if everybody used this in a responsible fashion, I wouldn't have a job. If everybody used everything in a responsible fashion, I wouldn't have a job. But the reality is, it doesn't work that way. And so you have to have some controls in place, because at some point it steps outside the bounds. The old adage, your right to swing your fist ends at the end of my nose. At some point, it's going to impact somebody else in some way, shape, or form. And again, from a control factor, you can call me a control freak if you like, but I wear polyester every day and I haven't killed anybody. I mean, this is the kind of thing that you have to deal with on a day-to-day basis. This is where it gets to the point where how do you excise that? How do you take that out of society and say that this isn't going to impact somebody in a negative way?
We're not promoting the idea of unresponsible consumption. You and I had jobs that when people went over the line, we were there. But that meant there were a lot of people that never came over the line. I have a liquor cabinet. I don't think I'm an alcoholic. And I hope that if I got to that point, either I have the reflection to recognize that, or somebody provides me with that hope. We're here today to say that adults are using marijuana responsibly now, and we want to shift that behavior from a criminal justice platform to a regulated industry to manage it. And you know what? Well, of course, for profit.
Let me ask you.
Wait a minute. I just want to finish this. I just want to finish this one thought. And every concern you've raised about addiction, I share with that. But not every consumer of those other products are necessarily addicts.
You can say anything about alcohol and tobacco, but the industry is the industry, and through its marketing, It's
That's
attracting
America.
children.
It's a market-based society.
So we want big tobacco 2.0.
I'm saying
That's
we
what
would
it
have
will
to
be. That's
deal
what
with
it is. That's what it is now.
Well, what do you want now?
I
Mexican
doubt that's
cartels?
actually
That's not
gonna
gonna go
end up in
away.
Maine. I mean, look at the small brewers we have here in Maine.
This is not about
big
small.
tobacco.
This is not craft.
Why do you think it's going to be big tobacco or big alcohol
80%
rather than the
Where's
small
the-
brewing market?
80% of the
Maybe we get like one at a time.
80% of the consumption, it's like any substance, 80% of the consumption is from 20% of the users. And those 20% are the daily users, which means addiction.
But I
And
can't-
so this is literally profits off addiction. How can we put forth that idea in our society to our kids that we need to have this for-profit industry to literally make profits off addiction when we don't have enough treatment resources as it is to deal with our addiction crisis? How is that a good idea?
Well, we have.
How do we tell our kids that's a good idea with a straight face?
Well, we tried telling our kids with a straight face that we're going to prohibit alcohol, and that's the way we're going to approach this. That we're going to use the criminal justice system to break up stills and smash barrels. But we recognize that was a mistake, and we've tried other ways. And maybe we haven't gotten the answer quite right yet, but we're still working on it.
How do I interdict this if in the non-responsible realm at this point? How do I do that? Because we're not set up for this stuff. You said early on they've doubled their amount of DREs, the drug recognition experts in Colorado. They're still short by about 50%. The reality is if you use this and you drive, or you do something else irresponsible, I can't take you down to the station and sit you and put you on a breathalyzer, which gives me a readout of 1.5. Bad idea. I have to take a test. In order to build probable cause to do that, I need a drug recognition expert who includes hours and hours and hours of training and retraining to come in and spend about an hour and a half with you deciding what you're on before I can proceed with probable cause, take a test, send it in to get tested.
And it needs to be blood.
It used to be blood, now it's urine, but you have to have it tested. This ties up.
How many drug impaired arrests have you made, Dan?
The question is,
No, I'm just curious. How many have you done?
I was kind enough to let you speak. Let me speak, please. How do you know? How are you going to know?
No, I know OUI. I'm asking.
The
about
question
drug
is, how are you going to know? How are you going to be able to set that apart from the alcohol? If you come in and somebody's a 0-0, I'm just saying, if somebody's a 0-0 and they're obviously impaired, now I have to go to a secondary DRE. I'm going to need. I've got 82 in the state right now. I would need a ridiculous amount of DREs. Almost
How would
everybody.
the law change that?
What's that?
How would the law change that?
In order to process an OUI, if you were OUI 0-0, I have to have a DRE. If you're impaired, and
So are you saying it's because you think there'll be more use?
Yeah.
Of course.
Okay.
well,
Yeah.
youth and adults. But how am I going to interdict that if I don't have what's in place to do it?
And
But
the other
how
thing, not
many?
only is it
You
going to
didn't
take
answer
more
the question.
time, but
We don't know.
there's no scientific threshold that's been established, like there is for everyone agrees that .08 OUI is, a threshold that we can all live with that is presumptive impairment. Pennsylvania has 1 nanogram. Some states have 5 nanograms. And there isn't any scientifically proved correlation between the amount of THC in your blood and the level of impairment. So we have no way.
There's Russian roulette on the road.
And there's no per se limit for Ambien either. But we've decided as a society that people should be able to have Ambien, and if they use it irresponsibly, they should be held for consequences for that.
saying you can
And just like
recreationally use Ambien.
but people do. And people might abuse any drug that's a substance that's legal.
Can I ask
We have a
one question? I
situation
know
where
you'll
we should
answer this,
enforce
Stephanie.
impaired driving laws, and that
You're
will not
good at
change.
answering questions. How many drug impaired cases have we had? Given the fact people are using marijuana right now, have your office prosecuted any cases?
Yes.
How many do you think?
That I don't know because our computer flag.
I trust your sense. What's your sense of it?
We can't get them through because we can't get the
let her answer,
DRE.
Dean?
This is part of the question. We can't get these things through the DA because we can't get a DRE on scene. We've had these things dumped because there's no alcohol, they're impaired, and we can't get it through the DA
And what do you
because
get
there's
for
nothing there
result?
that prevents it. We don't because we can't
walkaway.
get anybody there.
A walk away.
That's it.
Basically, we don't have the
So
capacity.
the
I
current
think, is
system
the-
isn't working, which
Absolutely.
is exactly part of our point.
And so you're gonna
Current
create
system isn't
more
working. And
drains
other
on it.
states that have done this, they've used the money to do public education campaigns directed at teaching people how to more responsibly behave and not to engage in impaired driving.
$14 million. It's
And
nothing.
It's a
And your
quarter
bill-
of a bridge. It's
No,
a quarter of a bridge.
we need to wind up, but I want to make sure anybody else on the panel has a question.
I just had one question. My whole life I've heard marijuana is a gateway drug. Can you respond to that?
Let me jump on that one. So, it is not the gateway drug. Let's get that straight, because that's a tactic that the other side uses to stigmatize our side. Is that you're in reefer madness? I hear anytime I say anything about marijuana, I'm reefer madness.
Even when you don't, we
You bring it up.
It is not the gateway drug, but it certainly is an entryway to addiction. And I want to make 2 points around this. So that's one. And one thing we know around federal data is when there's a marijuana addiction, you're at 3 times the risk of going on to develop a heroin addiction. It's 2 times for alcohol, so it's actually less for alcohol. And it is 40 times for prescription drugs. Let's just lay that out there. So it's not the gateway drug, but it is an entryway drug. And if we're bringing in an industry to market it and sell it, there's going to be more of that. But I lost my train of thought. So yeah, it's
a gateway drug.
Yeah, so it's not the gateway drug, but it certainly is. But there's one other point I want to make around this, which this is one of the things that's driven me absolutely nuts about this campaign, like since 3 years ago when they started in Portland, is just this underplaying, devaluing a marijuana addiction, like it's no big thing. Because what this implies, whether or not it's a gateway drug, what this implies is when a young person is addicted only to marijuana, that we're going to call that a success. That is the implication of that argument, is that if they only get addicted to marijuana and they don't move on to anything else, we're going to say, oh, that's great. That is not a measure of success. So whether or not it's a gateway drug, we should not be satisfied with youth or adults or anybody only being addicted to marijuana, which again, as Dean has pointed out, we're not talking about yesterday, 60s marijuana. These gummy bears are potent. These dabs and waxes are 60, 70, 80%, 90%. The process to make those is similar to a meth lab, and so you're going to have that legal. But again, I just want to say the idea that we can call only a marijuana addiction a success is an awful idea, and we should stop putting that out there.
So I would just respond and say, can I respond?
We'll let you get back.
So the gateway theory has been debunked all over the place, from the Institute of Medicine, now the National Academy of Medicine, the World Health Organization, the RAND Corporation, have all really done a lot of research debunking the gateway theory. The vast majority of people who use marijuana, which over 50% of adults in the United States and in Maine have, do not go on to use serious drugs or become addicted to anything. And in terms of whether someone who's addicted to marijuana as opposed to addicted to opioids or something that actually might kill them is a success, there's a very well-respected theory in the treatment world called harm reduction. And yes, harm reduction is important. So for the people who have chronic pain or making the choice between using and getting addicted to opioids or using and possibly, if they're correct, getting dependent on marijuana, then yes, that is a success. I know I'm not the only one who have had loved ones suffering from or die from opioid use in this state, and for folks like that and for their families, use of marijuana and even addiction to marijuana would be seen as a success. So yes, nobody here again wants to lead people down the path of that towards any kind of addiction or dependency, but we live in reality, we live in a world where again marijuana is in our streets and we're facing a tremendously serious opioid crisis in our state. So as far as choices go, yeah, I think that's the smarter, more reasonable choice. Especially since the vast majority of adults who use marijuana, again, never go on to use stronger substances, don't go on to become addicted, are responsible, tax-paying, productive members of our community who should not be facing penalties from the criminal justice system.
That would argue for heroin, yeah. Well, then why not make heroin legal?
How is anything I said argued to me?
Because not everyone, you're saying that there is responsible use.
I didn't say there was responsible use of heroin. I said there is responsible use of marijuana with people who use it either to treat illnesses or to use it to relax at the end of a day in the same way that someone would with having a beer or a glass of wine. And those people are not necessarily addicted or dependent, and neither are they creating any risk of harm for our community or for our youth.
And those people are using responsibly
right now. And they are doing it right now. So why do we have a law on our books, a criminal law on our books that they would be
Will you stop saying
violating.
criminal law?
What section of the statute is it in?
It's 2.5 ounces.
What section of the statute is it in? Is it in the criminal?
Well, your question doesn't change anything about 2.5 ounces, so that's still criminal. And then I just want to point out, addiction doesn't work the way that you think it does. You can't be, we're addicted to alcohol, if you're addicted to opiates, you can't just flip a switch and become addicted to marijuana instead. You can't just flip a switch and start using marijuana and your opiate addiction, your alcohol addiction magically disappears. Again, I've been in this field for over 10 years. I know how addiction works. You don't just turn on a dime like that. And and also more and more we're seeing polydrug use. In fact, the number one drug that people who are misusing prescription drugs, the most common secondary drug is marijuana. Addiction doesn't work that way. When you're addicted to a substance, you don't just flip a switch and magically become addicted to something else. That's not harm reduction. That's fantasy.
No, it's not. You see, just when I was going to agree with you, you throw something in there that makes a bump in the road. All right, I'll omit the fantasy piece. I think you're correct. And what Alicia and I and others have seen, and I've dealt with on a personal level, is those who can make a transition from an opiate-based lifestyle to using marijuana. Or if they want to go in a more legitimate route, we put them on Suboxone or methadone. I mean, that's harm reduction. We've decided as a community, and I think there's still consensus around that opiates are bad. And there is a way forward for them.
It's called
medically assisted, yes.
That's it.
All right.
All right, but I'm just saying.
Backed by science and research.
Yes.
But
But you're pretending, when you said fantasy, it was like being dismissive of how some people are introduced to marijuana. I mean, you make it all bad. There is some good there that is accomplished.
Well, great. Well, let's research it and let's have that developed by science, not policy.
If they're doing heroin now and they're doing marijuana tomorrow, there's not a problem. But we're talking about addiction. The law will consider addiction. We have to satisfy, we have to spend no time talking about federal guidelines and what they expect from a state that does this. But the number one priority is keep it safe from kids.
Well, they're not.
Okay, wait.
They're not doing
now you don't
anything
believe
like
in the federal government either. Okay.
We're not.
They're not. They have
How are we doing with alcohol?
Two separate arguments.
We're not doing well. We could do better.
And we're
don't
regulating
disagree
the
about
heck
that.
out of the alcohol industry.
But the point is, we do regulations with this basic assumption that the vast majority of consumers are responsible. We treat adults like adults. And we deal with the margins. The margins are tough for all our professions.
Well, Colorado has violated every single provision of that Cole memo, and the feds have not stepped in. So I'm not going
to. All right, I want to say something.
Okay.
This will be the last word.
Well, okay, and then I want to. Okay. We've been talking about whether or not marijuana should be legalized, and your paper is facing a decision as to what position they're going to take on this initiative. And so we've been talking for the last hour and 15 minutes about the wrong topic. Because the issue is the legislation. So putting aside how you feel about whether or not marijuana should be legalized, you really need to look at the initiative and what the legal structure that it sets out. And we didn't really get to that. I wanted to spend some time talking about that. Janet Mills, the Attorney General, who could not be here this morning, she's working on a memo about why the way the bill is written is so devastatingly bad for the state of Maine. And she's not taking a position pro or con.
Despite the fact that she was at a press conference opposing the initiative.
Well, anyway, so I'm providing you with a copy of what she sent me this morning. And it's about why the bill is bad. It doesn't address whether or not marijuana should be legal.
Your copy.
Thanks.
And I just want to, I think I'm the only one, if there's anyone here at this table who has also been to a pot store in Colorado, please raise your hand. You guys have been to pot stores in Colorado?
So did you go? Did you buy anything?
What a surprise.
I did.
You did, yeah. It's kind of interesting. You know, my father's complaint was that it was too clinical.
I bought
He wanted,
a cookie,
like, the
but I was
Berkeley
so scared that a
experience, and
dog
he thought
would
it was
sniff
too-
it on my way back.
A lot of explaining to do. Yeah,
I go into the store and there's this candy case full of gummy bears and Swedish fish. They're Swedish fish and gummy bears. And I said, oh my God, and so this very nice young man tells me, yes. I said, well, how many gummy bears is a dose? And he said, one gummy bear. And I said, well, how long does that take? And he said, about 40 minutes. I said, you want me to have one gummy bear and then wait 40 minutes? I said, what about a Swedish fish? 1/2 of a Swedish fish. And I'm supposed to wait 40 minutes. I said, that's crazy.
What was the
and he
problem,
said, ma'am, I think you should just smoke it. The problem is, it's devastating for kids.
But you had to show your ID to get in that store, didn't you? You had to show your driver's license.
You don't have to show the ID to your parents when they're when it's.
I had to show the driver's license to go in the store.
Once it leaves the store,
Stephanie's not going to let her kids or grandkids
But
get
Stephanie, I
access
go to RSVP now.
So we have no underage
they
drinking.
have orange soda that's got alcohol in it.
Which an 18-year-old can give to a 22-year-old and have within minutes.
And the police are there. But you know what? That license owner doesn't want that to happen. Most license owners
And there's nothing
want to protect their
in this bill that penalizes the retail shops.
No, well, thanks a lot. This has been great. This is the best one we've ever had.
An example of the type of thing that is already in dispensaries today. They're opaque, they're child-proof. This is the type of thing that will occur that doesn't occur on the black market today in the underground.
Yeah, but you don't have that in your bill.
This is the least boring meeting I've ever been to.
Thanks for joining us for this Portland Press Herald podcast. For more discussion on this issue, visit us at pressherald.com/opinion or send an email to lettersToTheEditor@pressherald.com. For more podcast episodes, visit our podcast page, pressherald.com/podcast, and you can always subscribe on iTunes.